Okay, let's unpack this. We're doing a deep dive today into something you probably never consciously connected. We're talking about how tall you are, your biological sex, and believe it or not, the actual physical structure of your eyes. Specifically, we're focusing on myopia, nearsightedness.
And it's really important we get into this.
Yeah, the stakes here are, well, they're enormous.
Yeah.
And only getting higher, actually. Myopia isn't just like needing glasses anymore. It's shaping up to be a global public health crisis. We're talking about this refractive error possibly affecting 50% of the entire global population by 2050. That's 5 billion people.
5 billion. It's staggering.
And critically, that also means the severe version, high myopia, is going to just skyrocket too, which, comes with really serious complications. Retinal detachment, glaucoma, things that can tragically lead to blindness.
It really makes understanding the mechanics of how our eyes grow absolutely urgent. And the source material we're digging into today takes a really fascinating approach. It zooms right in on a specific, crucial time in development. We're looking at myopic children aged between 8 and 14.
Okay.
And the core mission of this research is, well, it's quite elegant, actually. It asks, do ocular growth, which we can measure very precisely, the eye's length and overall body growth is measured by height, do they operate under some kind of shared biological control?
A shared mechanism.
Exactly. And if they do, how does biological sex maybe complicate that picture or perhaps even clarify the connection?
Okay, right. So before we dive into the surprising data they found, let's just quickly lock down the key terms we'll be using.
Absolutely. Good idea. So when we talk about eye growth, we're mostly focused on something called axial length, AL for short. That's basically just the front-to-back measurement of the eyeball itself. Think of it like measuring the length of, say, an egg.
Okay, simple enough. Axial length.
And myopia, nearsightedness, usually happens because that axial length is too long. The eye is just elongated. The other key term is spherical equivalent, or SE. That's the technical way of talking about the prescription strength, the vision score.
Right, like the number on your glasses prescription.
Precisely. And generally, the longer the eye's axial length, the more negative that SE number becomes, meaning, well, the more nearsighted the person is.
Got it. Okay. So axial length, eye length.
Yeah.
Spherical equivalent vision score. So the researchers took this data from these kids, aged 8 to 14, and started looking for connections. And here's where it gets really interesting. They did confirm that the basic connections we kind of intuitively suspect, they're definitely there.
They are.
They found significant correlations between these three main factors: eye length, AL, body height, and vision score, SE. So taller kids, generally speaking, tended to have longer eyes. That makes sense. And maybe unsurprisingly, longer eyes meant a worse vision score, more nearsightedness. What seemed particularly important, though, was the correlation between the eye length and the vision score. It was described as moderate.
Right. And if we connect that to the bigger picture, it really strongly supports the theory that, eye growth isn't just happening in isolation. It suggests that overall, taller individuals do tend to have longer eyes. And both of those factors, height and eye length, are associated with a greater degree of nearsightedness. It fits with previous research.
Okay, that feels kind of intuitive, doesn't it? Like taller people just have sort of bigger parts overall. But there was a surprising wrinkle when they factored in age, wasn't there?
Exactly. That was quite revealing. Age itself was, as you'd expect, strongly correlated with body height. I mean, older kids in that 8-14 range are generally taller. But, and this is the crucial part, age showed no significant correlation with the eye length or the vision score itself.
Huh. Okay, unpack that. Why is that distinction so critical?
Well, it suggests that it's not simply time passing that causes the vision change or the eye to get longer in this context. It seems to be the underlying growth process that happens during that time. Whatever biological signals are triggering that growth spurt, they seem to be affecting both the overall body size and the eye simultaneously.
So it points back to that shared mechanism idea.
Precisely. We're likely talking about shared genetic influences or perhaps nutritional factors that impact both processes at the same time.
Okay, so the basic correlation is confirmed. It's linked to growth, not just age. But then the researchers dug deeper. They started grouping the eyes by length. And that's where this idea of a simple straight-line relationship kind of broke down completely. This leads us into this really interesting concept of nonlinearity.
Yes, this is fascinating.
They basically categorize the eyes into three simple groups: short eyes, medium eyes, and long eyes, based on axial length. And the natural assumption would be, okay, as you move smoothly from short to medium to long eyes, you should see a smooth, consistent increase in height and a smooth decrease in vision score.
Right, a proportional change, but that's not what they found. What's really fascinating here is the evidence for more of a threshold effect. The significant differences they saw in body height and in vision score were found almost exclusively in the longest eye group, group 3,
Only in the longest group.
almost entirely. That group, the ones with eyes longer than 25 millimeters, was statistically significantly taller than the other two groups. And they had significantly worse vision scores, more negative SE compared to both the short and medium eye groups.
Okay, but what about the difference between the short and medium groups?
And here's the really surprising bit. There was absolutely no significant difference found between the short eye group, group 1, and the medium eye group, group 2. Not for height and not for vision score either.
Wow. Okay, so if the relationship was just simply proportional, like longer eye equals proportionally worse vision, we absolutely should have seen some difference between the short and medium groups.
We should have, but we didn't.
So that lack of difference in that sort of middle range really throws a wrench in the works for a simple, smooth progression idea.
If the medium-length eyes look statistically the same as the short eyes in terms of height and vision, what does that imply? Maybe the eye is correcting itself somehow.
It strongly implies that a robust corrective system is at work, yes. This lack of difference between the low and medium AO groups really supports this hypothesis of a nonlinear relationship.
Yeah.
It suggests that as the eye length increases, the vision score does become more negative eventually, but not necessarily right away, and not in a simple step-by-step proportional way. And this non-proportionality likely happens because of the eye's incredible natural effort to maintain clear vision, a process we call emmetropization. During this process, especially during growth, the eye uses compensatory tricks, like maybe flattening the cornea slightly.
To try and keep the light focusing exactly on the retina, even as the eyeball itself is getting a bit longer. And these mechanisms, these tricks, seem to be highly effective in that sort of medium-length range. Effective enough to mask any statistical difference from the shorter eyes.
Right, until they can't compensate anymore.
Exactly. It's only when the eye seems to cross that critical threshold, getting into that long eye group over 25 millimeter, that the natural compensatory system seems to finally get overwhelmed or break down. And that's when the nearsightedness appears to accelerate rapidly, becoming statistically significant.
Wow. So the eye is almost actively trying to hide the changes, fighting against the elongation until it physically just can't keep up anymore. That really shifts the focus from just simple growth to more of a dynamic battle between growth and correction.
A battle is a good way to put it.
Okay, so to test this nonlinearity idea further, they flipped the analysis, right? Instead of grouping by eye length, they grouped the children by their height percentiles, basically, low, medium, and high height groups. Did that confirm things?
It added even more nuance, actually. It wasn't quite a mirror image. So when grouped by height, yes, the high height percentile group did show significantly longer eye lengths than the other two groups. That fits. But again, mirroring the previous finding, there was no significant difference in eye length between the low height group and the medium height group.
Interesting. So having really long eyes seems linked to being tall, but being tall doesn't automatically mean your eyes are much longer than someone of medium height?
It seems that way, yes. The long eye measurement seems disproportionately linked to being in that highest height percentile. And then there was another twist with the vision score trend when grouped by height. Here, the significant differences in vision score actually started with the lowest height group compared to the medium and high groups.
Wait, the shortest kids had significantly different vision.
Significantly better vision, yes, compared to the medium and tall kids. But intriguingly, there were no significant differences in vision score found between the medium height group and the high height group.
Okay, hold on. Let me try to picture this. Exceptionally long eyes correlate with being taller. But being exceptionally tall doesn't necessarily mean much worse vision than someone of medium height. Yet being in the shortest group does correlate with significantly better vision than medium or tall groups.
That's the complex picture emerging from this data set. It really confirms that this is an interconnected system, height, eye length of vision, but it's definitely not operating on a simple, predictable straight line. There are thresholds and complex interactions.
Okay, definitely not straightforward. So let's bring in the final variable you mentioned earlier, the one that adds another layer of complexity. Biological sex. We've established eye growth is linked to body growth. So does sex, which obviously dictates different growth patterns and timings, factor into this myopia equation?
It absolutely does. And quite clearly in this particular sample of 8 to 14-year-olds, when they analyzed the data based on sex, significant differences popped up between boys and girls for all three variables we've been discussing.
All three. Height, eye length and vision.
All three. To be specific, in this age range, the male participants consistently showed, while greater physical development metrics on average, they were taller than the female participants, they had significantly longer axial lengths, longer eyes, and consequently, they also had significantly more negative spherical equivalents, meaning they were, on average, more nearsighted in this group.
Okay, so in this specific 8 to 14 window, the results consistently pointed toward the boys showing greater overall growth and more eye elongation and more myopia, which really begs the question, why?
Yeah.
Why did the boys in this specific age group show higher levels across the board?
Yeah, and this is a really crucial area for interpretation, and it leads us directly back to our earlier discussion about age, actually.
Right.
The researchers specifically noted something interesting. Only in the female participants was older age associated with a more negative vision score. That trend didn't hold for the boys in this sample.
Okay, why does that discrepancy matter?
Well, it almost certainly relates to the timing of puberty. For many girls, the major growth spurt associated with puberty tends to happen earlier than it does for boys. Since this study focused specifically on ages 8 to 14, many of the girls might be past, or at least nearing the end of, their peak growth velocity period.
While the boys are just hitting it.
While many of the boys in that same age bracket are often still accelerating, right in the middle of their most intense growth phase, and puberty, as we know, is driven by massive hormonal shifts and physical changes. It's a huge driver of growth. So the fact that the boys showed higher overall growth traits height, AL, SE, might simply reflect that, at the time of measurement, they were the group currently undergoing the most aggressive period of growth acceleration.
Ah, okay, so it might be less about an inherent lifelong difference and more about when the measurements were taken relative to their individual puberty timelines. So if you ran this exact same study, say, at a group age 15 to 20, we might see the data look quite different, maybe flatten out or even shift.
It's entirely possible, depending on who finished their growth spurts first and how things settle post-puberty. It really reinforces that we have to be careful and always contextualize these kinds of findings within the specific developmental timeline of the subjects being studied. Age and pubertal stage are critical context.
Okay, that makes a lot of sense. So now that we've kind of wrestled with the data, the correlations, the nonlinearity, the sex differences, let's talk about the payoff. What's the so what? What does this mean for you listening or for clinicians on the ground dealing with myopia?
I think the knowledge is highly valuable, particularly for optimizing eye care, and maybe more importantly, for potentially mitigating the risk of developing high myopia later on. Clinically speaking, the mathematical models that eye doctors have traditionally used to estimate axial length, which is hard to measure directly sometimes, those models relied almost exclusively on just two factors: the patient's vision score, SE, and their corneal curvature. And they're generally pretty accurate most of the time.
But there's room for improvement.
Definitely. These sources suggest a major opportunity for optimization. The results really back up the hypothesis that incorporating individual systemic characteristics, things like body height, which, let's face it, is already measured routinely by every pediatrician.
Yeah, super easy to get that data.
Right, and maybe even sex. Adding those into the mathematical equations could provide a much more complete and ultimately more accurate prediction of axial length, especially perhaps in those borderline or high-risk scenarios where pinpointing AL is most critical.
So what you're saying is a simple, easily tracked measurement like height could potentially significantly improve these existing predictive models, specifically to help better identify those kids who might be rapidly approaching that critical nonlinear threshold we talked about, where the eye's natural coping mechanisms start to fail.
Yeah, precisely. That's the potential power here. If we can get better at predicting the true axial length, especially its trajectory, we can then get better at predicting who is most at risk of developing severe myopia before it progresses too far. Think about the formulas that are built into those myopia progression predictor calculators. You know, the tools often integrated into clinical devices or apps that doctors use to plan treatment.
Right, the ones they use to talk to parents.
Exactly. Improving the accuracy of those underlying calculators is absolutely essential, both for professional management, choosing the right intervention at the right time, and, just as importantly, for having accurate conversations with parents and patients about what to expect and what the treatment options realistically are. Imagine if knowing a patient is both particularly tall and male, and within that critical 8 to 14 age bracket, automatically triggered a higher level of alert or a different pathway within the clinical model.
Yeah, that really connects the dots, doesn't it? Between just general systemic health and growth and these highly specific ophthalmological measurements. It takes the problem out of just the eye doctor's office and puts it back into the broader context of general pediatric growth and development.
That's a great way to frame it.
Okay, so to quickly summarize our deep dive today, we've confirmed that the relationship between eye shape and vision is definitely strongly linked to overall physical growth, especially height, particularly during this critical 8 to 14 age window. We've learned this relationship is really intriguingly nonlinear. The eye seems to have these amazing mechanisms to compensate for increasing length until it hits a kind of critical threshold, after which the nearsightedness seems to accelerate. And we've seen that in this key age group, boys tended, on average, to have longer eyes, greater stature, and more nearsightedness, which is likely significantly influenced by the different timing of puberty compared to girls.
A very good summary. And maybe this leaves us with a final provocative thought for you to consider. We know from this study that axial lengths and myopic refractive error were higher on average in the male subjects. And while we've reasonably attributed much of that difference in this age group to the timing of puberty, consider this possibility. What if future, very carefully designed longitudinal studies that follow the same individuals over many years, confirm that some of these differences in eye length between sexes persist even after you statistically adjust for final adult body height?
So if it's not just about being taller.
Right. If simple stature isn't the only driver explaining why males might end up with slightly longer eyes on average, what underlying shared biological mechanism, maybe a common hormonal pathway or a specific growth factor that influences both bone growth and eye growth, might be driving these potentially profound differences in eye structure between the sexes, independent of just how tall someone ends up being? That, I think, remains a fascinating, wide-open question for future research to explore.